My name is Hawkfeather Peterson, and I live in Sechelt, BC, and I work as an activist and advocate for people who use drugs. I am the secretary and one of the executive board members for CAPUD, Canadian Association of People Who Use Drugs. And I'm the vice president of the BC Yukon Association of Drug War Survivors. And I work with Children's Hospital and Women's Hospital and the Provincial Perinatal Substance Use Task Force and the Overdose Emergency Response Center and the BC CSU and a whole bunch of different groups. And but they're all the same. And I work as someone with lived experience that can advocate for my peers, and hopefully I'm an ally. And I live in a rural community, so a lot of what I observe is the gaps in care, the things we discuss at the tables with government officials and health authorities. They rarely trickle down into rural communities. So firsthand, I get to observe how my work doesn't impact the people I actually live with or myself. And in Sechelt, I think it's a fairly prime example of how BC responded to the overdose crisis. They started a Ministry of Mental Health and Addictions, and they in turn started the Overdose Emergency Response Center. I'm not sure which came first, but those two things were the main response to the overdose crisis. And then they handed out money to, I think, 22 communities at first that were called CAT teams, community action teams. And I happened to work with the CAT team on the Sunshine Coast in Sechelt. So we get to watch how ridiculous of a response that is. I had a friend that said once, you would never see that with cancer. You would never see any other health emergency where they just handed out cash to uninformed mayors and said, good luck.
Yeah.
And that's basically what they did with the overdose crisis. So where I live, we have a fairly good CAT comparatively to other communities, but we still have people in the CAT that are, seen as authority figures in our community, and they do kind of hinder some of the work that we want to do. They're not really experts or even very educated or informed about harm reduction or being a drug user, and yet they have quite a lot of control over how our funding gets spent to help people. And it's a big problem, really. Even well-intentioned people, if they're not educated or informed, can be, reiterating archaic views that aren't necessarily helpful and can even stigmatize unintentionally. We had a situation where we set up a drug testing event with the BC CSU, and they were going to bring an FTIR machine, and we were going to introduce it to our rural drug users. And I think 2 days before the event, someone in the mayor's office was like, what about the children in town? What do we do? And they shut it down. They
just
took
because
away
you're
our
bringing
space.
one of the Spectrum machines.
Yeah. Well,
testing,
we also asked that people be able to use safely in the space, because if you're gonna test, what do? Send them out with potentially dangerous drugs and just help they fend for themselves. So it was like a pop-up safe consumption event combined with a drug testing event, but they didn't allow us one part and take away the other. They just canceled the whole thing. They actually first tried to just take away our location, give us another location, and they told us it was because it was beside the police station it would be more useful. But that also meant people would be less comfortable, we'd have less attendance, and when we tried to engage, they were pretty harsh about it, and they really responded quite negatively, and the event got canceled. We had peers show up that needed their drugs tested and had no way to test them, and it's just kind of one example of how this funding went out to people that really don't know what they're doing and aren't necessarily as well-intentioned or experienced. And it's happening in a lot of rural communities. The emphasis is largely focused on the downtown east side, and the rural communities suffer because all of our policies and procedures, all of our programs, they get started in the downtown east side, and so they're really based on the needs of that community. So when they try to get implemented in other communities, it doesn't necessarily work. But that's what we're doing.
So is there one big hope that you have for the coming year in terms of change for Sechelt?
Oh, too many to list.
Okay.
I'm hopeful for safe supply for the entire province, for the entire country,
Oh.
for all of North America. Really, I would love to see the police shift their priorities from harm and oppression into help and harm reduction. But for Seashell, I would really love to see an increase of funding for peers, some more employment opportunities. I'd like to be heard more. I'd like us to have more prescribers. We only have one, really. So we need some nurse practitioners and other people that can actually prescribe there. I would love to see some IOTs there. I'd like to see people have more options. Hello. So yeah, that's some of my big hopes. Yeah.